I'm Dr. Asim Javed. I'm an interventional cardiologist working at Rawalpindi Institute of Cardiology in Pakistan. This is a series of talks to facilitate learning process for performing mechanical thrombectomies in acute ischemic stroke. Now, there are many types of stent retrievers that are available in the market. But in Pakistan, we've got this Solitaire. Now, the latest one is Solitaire X from Medtronic. Then we've got this preset, which has recently come in. We've got Eric from Microvention, and probably Embu Trap may be coming very soon. So Medtronic has Solitaire X now. This is Solitaire 2, but now we have the Solitaire X. Then we've got this Navian, which has now been replaced by React catheter, which comes in 0.68 and 7.1 sizes. Then we've got this Rebar micro catheter. Their 014 wire is silver speed, and they've got a balloon tip guide catheter, which is cello. And on the other hand, Microvention, which is Terumo, they've got this Eric retrievable stent. They've got this Sophia Plus and Sophia. Sophia is 5 French, Sophia Plus is 6 French. These are the intracranial sport catheters. You can call them intermediate catheters, or you can call them the aspiration catheters. Then they've got Headway, which is their micro catheter for the delivery of stent. And then there is Trexus guide wire, which is the 014 guide wire. And then Asahi has also brought their wires to Pakistan, which is neurointervention wires Chikai, and they've brought their guide sheets, which are dedicated for neurointervention, which is Fubuki. The Solitaire X stent has the capability, it's got 6mm and 4mm two sizes available, and it has the capability that the 6mm stent, even if it's put in a 4mm stent, it tends to overlap, increase its overlap and still gets accommodated in all sizes of vessels. Now, balloon tip guide catheters, again, there is a variety available, but in Pakistan, we've got this Cello Medtronic, and this comes in 8 French and 9 French. If you want to use a Sophia 6 French aspiration catheter with the Medtronic balloon tip guide, then you've got to use a 9 French Cello guide, and that will accommodate a 6 French Sophia Plus. So why do you need a balloon tip guide catheter? This model is going to show you that. So this is a balloon tip guide here, and you can see a lot of forward blood flow going there. There's a clot over here, and there's a stent retriever which is deployed now. So now we're going to inflate the balloon of this balloon tip guide. You can see the balloon inflated, and look how the forward flow has stopped. And once you start aspirating through the vacuum, you produce a vacuum on the guide, and you are pulling the stent retriever back, so the clot has come in, and without any distal embolization, the clot has all got sucked through the guide catheter. And once you deflate the balloon, you can again see the fast speed forward flow going ahead. Now, another example within a model to show the same. This is a balloon tip guide here, and that's the clot, and it's a RBC rich clot which is very fragile, and you can see it fragmenting within the stent retriever. The stent retriever is pulling it back. The balloon is inflated here, which you can't see now, but because the balloon is inflated and forward flow is not there, you can see that all of these small fragments, instead of going distally, they are all coming back, and there's vacuum or suction effect on the guide catheter, and it has managed to pull everything out. So what are the advantages? We've already discussed reducing the risk of distal embolic events due to flow arrest. Then we can do manual aspiration on it, so that causes flow reversal as well. And then so it is actually preventing unaffected vessels from getting this embolized material in them. And it increases your chances of retrieval. Another advantage of using a balloon tip guide is if you've got a difficult anatomy ahead of the guide catheter, and it's difficult to take your micro catheter and your sport intermediate catheters to the point of occlusion, you can simply inflate the balloon here of the guide, and now the guide is not going to back out, and you will have enough support to take your hardware forward. So the guidelines have given it a class 2A indication for use. Now, aspiration catheters again are available from different companies, but the ones that are available in Pakistan are Medtronic, Navian has been replaced by React, and Sophia Plus are available from Microvention. So you call it distal access catheter, you can call it aspiration catheter, you can call it sport catheter or an intermediate catheter, whatever name you want to give it. The advantages are that you can gain and retain intracranial access. Difficult access anatomies you can just traverse with this, and then you've got effective mechanical embolectomy device that you can combine it with the stent retriever, and that makes you can use it as for aspiration alone, or you can combine it with a stent retriever, and then it becomes even more effective. So the recipe for success in neuro intervention is this tower of power. What is that? You have to increase the power and the support as you go forward and you face more difficulty. So you've got a guide catheter here, and through that is going an intermediate catheter, through which is going a micro catheter, through which is going your wire. So if the wire has difficulty going ahead, you have to take your micro catheter forward. If this has difficulty going ahead, you have to take your intermediate further forward. If this has difficulty going up because of tortuosity, then you have to take your guide catheter or your guide sheath further ahead. So that's how you keep increasing your support and your hardware keeps advancing. Now this is just to show you how the setup is. This is a cello guide which is in place, and through the side arm you can see this is contrast attached here. This is for inflating the balloon at the tip of the guide catheter. Through the main central lumen we've connected a Y connector here, and this Y connector has a side arm which is attached to a continuous flush line. So there is no heparin on board. You don't give heparin to these patients in neurointervention. Therefore, you have heparinized flush prepared. So in 1 liter of saline bag, you have 2000 units of heparin in them, and you have 4 pressure bags and 4 salines hanging with them for all stroke interventions. And the first pressure line, you can number them 1, 2, 3, 4. The first one gets attached to either the guide sheath or gets connected to this guide catheter through this Y connector, and this flush is continuously going on. It's not high pressure with it's going on. It's just controlled drop by drop. Of course, the pressure is high on the bag, but it's a drop by drop flow just to maintain the patency of the guide catheter so that it doesn't clot in it. So through this Y connector, you can see that there is a intermediate or a sport catheter or an aspiration catheter going through it, which is again connected to another second Y connector, which has a second flush line which is going and getting connected to a second pressure bag, and through this is going a micro catheter. So you can see here that's the micro catheter, which is again connected to a third Y connector, and it has a third line which is a flush line going and getting connected to a third pressure bag there. So you need at least 3 Y connectors to take every lumen catheter that goes in has to be connected to a Y connector and a flush line. So this is the total setup. This is how you set it up. And then this is just to show you that you can have a torquer there. You can take a wire through this microcatheter or a stent through this, and then you can, to the side arms of these Y connectors, you can even attach these aspiration vacuum syringes. So in total, this is the list that is displayed in our cath lab, and for every patient, when the stroke patient is coming, they prepare a trolley and they put things on the trolley for that patient. So you've got to be prepared for conscious sedation, which is better than giving general anesthesia, because in general anesthesia you can have pressure drops, and sudden pressure drops are not good for these patients. So conscious sedation, local anesthesia is the best. If not, then conscious sedation. If not, then general anesthesia. So you've got to have a head stabilizer, which I'll show you later, and you've got to have arm and leg straps to control the movement. Then you've got to have a diagnostic 5 French catheter. I prefer to use a Asim 2. This is my favorite. Very easy to maneuver and negotiate difficult aortic arches. Then you can either have a Vitek or Bernstein. Then in guide catheters, you have a choice of 8 or 9 French cello guide balloon tip. You can use a simple 8 French multi-purpose guide catheter, 90 centimeters. You can use a 90 centimeter destination sheath, 6 French from Terumo, or you can use Asahi Fubuki sheath. These are the things that are available in Pakistan. In intermediate catheter, as I said, you've got choice between microvention and Medtronic. Again, similarly, you can use one of these micro catheters. You can use one of these stent retrievers. You've got angioplasty wire and you've got a choice between these different wires. You've got to have a 260 centimeter exchange length 035 wire, 3 Y connectors, 60 ml lower lock syringes, 2 20 ml lower lock syringes, 2 10 ml syringes, 1 3 ml lower lock syringe, 4 pressure flush lines, and you've got to have femoral sheaths. So we have all of this on the trolley next to our patient, and then we keep using things as required. Now, just to show you how the setup is, I'll show you a video how the setup is done.
So ये आपकी 6 फ्रेंच डेस्टिनेशन शीट है 90 सेंटीमीटर की, जिसके पीछे एक वाई कनेक्टर है और ये पीछे से कनेक्टेड है प्रेशर मैनिफोल्ड एंड फ्लशिंग के साथ। और उसके बाद ये इसके थ्रू जा रहा है सोफिया प्लस, ये भी एक वाई कनेक्टर के साथ आगे से कनेक्टेड है एक और मैनिफोल्ड के साथ एंड प्रेशर लाइन के साथ। उसके थ्रू जा रहा है माइक्रो कैथेटर जो कि कनेक्टेड है एक और वाई कनेक्टर के साथ, और ये प्रेशर लाइन के साथ नहीं बल्कि सिर्फ फ्लश लाइन के साथ कनेक्टेड है। इसके थ्रू आपकी वायर जा रही है, इसके थ्रू आपका स्टेंट जा रहा है, इसके तो हमने वायर की वजह स्टेंट डाला हुआ है जो कि इसके थ्रू जा रहा है। अभी हम सिस्टम पुल आउट करने के लिए तैयार हैं। सो एक 60 ml की एस्पिरेशन के लिए सिरिंज लगी हुई है सोफिया प्लस के ऊपर, और एक 60 ml की एस्पिरेशन सिरिंज इस वक्त लगी हुई है आपके गाइड कैथेटर के ऊपर जो कि डेस्टिनेशन शीट है इस केस में।